Today is World Atopic Eczema Day. It's a day to create awareness for one of the most common skin diseases in the world, we're told. South African patients of atopic dermatitis will be pleased to learn, though, that an approved biological treatment is now available. This new therapy has transformed the treatment for patients around the world and raised hopes for a better quality of life in some instances. Global life sciences company Sanofi Genzyme, the medical advisor there at least, Dr. Lourens Terblanche, joins us via our video link to share a bit more about what we know about this ailment and perhaps what we know about the new treatment that's available. Dr. Terblanche, it's great to have you on the program. Thanks for making time. Let's speak about atopic eczema first. What do we know about it, and in what ways does it complicate one's life?
So I think important to start is just to explain a bit about what atopic dermatitis or eczema is. So the two terms are sometimes used interchangeably, whereas atopic dermatitis or atopic eczema is actually a specific kind of eczema. So when you try and understand what a disease like that with a relatively complicated name means, I always think it's a good idea to break it up into its parts. So atopic in this context means allergic or from a allergenic origin. Derma refers to the skin, and then itis refers to inflammation. So essentially what eczema then is, or what it means, is that you have this chronic inflammatory skin condition. It's characterized by having these repeated flare-ups. So flare-ups of what? Flare-ups of having essentially a skin rash. And this rash is quite debilitating for a number of different regions. Not only is it quite obviously visible, it has a red appearance, it can be scaly, it can be anywhere on your body. There's characteristic areas where we often see it, but it can be anywhere. And then most debilitating is that it is exceptionally itchy, or what we call pruritic. So pruritus means that it is itchy, and this itchiness can be exceptionally debilitating. It can be present at any time of day. Patients often say it's worse at night. So you can imagine having this constant itchy rash means you're not sleeping properly. Not sleeping properly, as we know, has then a lot of secondary effects, not only on your work or school productivity. It starts having an effect on other conditions related to poor sleep. And not only does it affect the patient, but it affects their family and friends and interpersonal and social circumstances as well.
Sure. One can imagine the ways through which that makes life a bit uncomfortable, for lack of a better term. Have we seen trends of who's more susceptible to develop this disease, or is it a bit more invariable than that?
So we see most cases, up to 90% of cases, diagnosed in children under the age of 5 years. So definitely a higher incidence in kids. We do eventually see that some patients grow out of it, so to speak. So we'd say in children, about 10 to 13% of kids have eczema. By the time they go into adolescence or adulthood, it comes down to about 3 to 10%. In terms of children, the distribution between boys and girls are relatively equal. In terms of adults, we see more males grow out of the disease, but generally still an equal distribution.
Is race or pigmentation a factor?
It's difficult to say, especially in South Africa's context. We don't necessarily have the kind of data or registry data to comment on that. There's sometimes we see a bit of a worsening in patients of African descent. We do also see then from a treatment perspective, sometimes the rash may be slightly less visible. So then also treatment can be unnecessarily postponed because the rash isn't that visible up front necessarily.
Sure. Let's speak about this new way of treating the disease that's come through. I mean, there's talks of some kind of biological treatment that's now available. The presumption there is that it wasn't available before. Help us place into context how significant this is.
So I think when one speaks about biological therapy, it's important to also understand the disease you're trying to treat with this. When we look at eczema or atopic dermatitis, it's important to understand that not only is this a skin disease, but it's also an immune system problem. So essentially your immune system is overreacting to what it's exposed to. So this can be allergens or certain day-to-day things. It can be pollen, anything that irritates your skin, which leads to the inflammatory reaction in your skin, which leads to itching, which leads to scratching, which continues that cycle that vicious cycle almost of having repeated exposure then, because when patients with eczema scratch, they break their skin barrier, and this allows the opportunity for more irritants and allergens to enter their skin. So this process essentially feeds on itself. So that's why it's important to aim our therapy at addressing exactly this problem. So when it comes to biologicals, which is quite far down the end of the treatment armamentarium, it means that we have, with ongoing research, identified exactly which components of the immune system are involved in atopic dermatitis. So when we look quite closely, we see that there are what I can explain as messenger molecules, which tells your immune system when to react and how to react. And two of these are interleukin-4 and interleukin-13, and they have been seen through ongoing research to be quite prevalent and involved in atopic dermatitis. So what biological therapies allow us to do, it allows us to really focus a drug or a treatment at a specific target. So with newer biologicals, we see that they are targeted at these messenger molecules, or these interleukins as we call them, and they block their messaging. So instead of giving a therapy where you can't really direct their target. So for example, immunosuppression can be a component of managing eczema because of the immune system component, but that has lots of negative effects, and it aims at broad spectrum approach to a small target, versus biologics allows us to really focus in on exactly where the problem is with less side effects.
You've mentioned how children could outgrow this type of eczema, but can adults develop it within their adulthood? And if that's the case, are you seeing trends about what might trigger that?
So it's less common for the onset of this disease to be in adulthood. It's not impossible. We see general trends of what a disease looks like, and with atopic dermatitis, the diagnosis is a clinical diagnosis, which essentially means there's no one test that you can do to confirm that this is eczema. So the way to approach your diagnosis for eczema is to look at the rash. What does it physically look like? Is it red and scaly and dry, as we typically see with eczema or atopic dermatitis? Where is the rash? We often see, or usually see, atopic dermatitis in what we call the flexural surfaces. So that's where your skin folds. So you can think about it as not only when skin falls, but when it rubs, or where it rubs against each other. So that would be like at the back of your knees, or on the inside of your elbows, around your neck even. So looking at those characteristic features that we associate with atopic dermatitis, it guides you to a diagnosis. As I said, it's less common to see the onset in adulthood, which means you need to ensure that you're excluding other diseases which may have a similar presentation at the start before you then conclude that the diagnosis is eczema. It's also important to take a family history. So atopic dermatitis forms part of the ATP triad, as we call it. So this triad of A's, as we call it, is atopic dermatitis, allergic rhinitis, or hay fever, as we call it, and asthma. So what you often see is that patients who present with atopic dermatitis have either a family history of any of these diseases, or they themselves also have one or more than one of these components of atopic diseases at the same time.
Sure. Usually the fear around rashes is that they're contagious. Is that the case also with this disease?
Not at all. So atopic dermatitis is not contagious. As I mentioned, it's an immune system disease primarily. On top of that, the skin barrier dysfunction that you find. So, which is an important point in you asking that question. You asked earlier also about the impact on a patient's life. So you can imagine having this visible rash has a psychological impact on a patient as an individual. And then often with that comes the stigma that this rash, which is very visible, it may be oozing or crusting even, is this contagious? So it highlights the impact psychologically that atopic dermatitis has on patients. It's not only a skin disease that's exceptionally itching, that can be very painful as well. It can be embarrassing for patients because they have this skin lesion that is visibly or visible to their family and friends and colleagues. So in that regard, it's important to not focus only on the skin disease or the immune disease component, but take into cognizance the psychological impact. We see with some patients that there's a tendency towards developing depressive symptoms about the circumstance as well. It can lead to anxiety. As I mentioned, not sleeping properly or sleep disorders in itself predisposes you to a whole range of negative effects down the line. So it's important to approach managing an atopic dermatitis patients quite holistically.
Absolutely. Important discussion. Thanks for breaking it all down for us. Really do appreciate it on this World Atopic Eczema Day. Appreciate your time. Dr. Lourens Terblanche is a medical advisor with Sanofi Genzyme. Once again, thanks very much indeed.